Now this video segment is being made for you to study how to study the prostate. Place the probe in the suprapubic region with the moderately filled urinary bladder. I disagree with the extensive filling of the urinary bladder because that will hinder the view of the prostate. So anyways, first of all, place the probe transversely above the suprapubic, just above the suprapubic region. This is the suprapubic region, and transversely, and see, you will get the urinary bladder. Now once you get the urinary bladder, slightly move the probe towards the patient's legs downwards. This is your maneuvering slightly where you will get the prostate. Now go down up to the extent where you can get the complete prostate. Otherwise you will not be able to get, if you don't angle the probe properly towards the patient's leg or post, you may not get a full view of the prostate. So this is maneuver number 1 in transfer section. Just simple, very simple. Place the probe in the suprapubic region, angle it towards the patient's foot, and then get full view of the uterus. Secondly, then you will, keeping the probe over here, you see, with the same angle, approximately 60 degrees will be enough, 60 to 70 degrees. Now you're keeping the probe in this where you are getting the prostate. In transfer section, you rotate the probe in sagittal section, keeping the view in the center of the screen, longitudinal view, 90 degree sweep, and with little bit of maneuvering towards the right, left, a little bit, wherever you feel comfortable. You can comfortably get the prostate. Then this will be your maneuvering. Now once again, straight downwards, then 90 degree angle, and then a bit downwards. You may have to go downwards and move the probe towards the right, left, wherever you get the prostate in full. Okay, now let's see on the ultrasound machine. You see here I have placed the probe just above the at the suprapubic region, and I am getting what I am seeing is the seminal vesicle. This is the seminal vesicle, they will appear, and this is the urinary bladder in transfer section. Now I am going to move the probe towards the patient's legs or downwards, and here you will see hypoechoic rounded area bounded by periprostatic fat. This is the periprostatic fat anterior to it, and this whole area is the prostate in transfer section. Now if I just finish it here, then it's wrong. I'm not getting the full view. The full view is this one, and if I go further downwards, I will lose the view. So this is, if you can move the probe upwards, downwards, and you will ultimately come to know which is the full area that you are getting in transfer section. Now this is the prostate in transfer section with intact periprostatic fat. Now what I am going to do, I am going to keep the probe at the same angle and move the transducer 90 degrees. Here we are, and I get this is the longitudinal section of the prostate. This is the prostate. Now remember one thing, you will see a hypoechoic area, tail-like area extending laterally. This is the seminal vesicle. This is not the part of the prostate. Now this is the urinary bladder. Let's do it again. I said you that you may have to angle the probe right, left, Wherever you get a proper view, again transfers. Let's get the transfers. Then 90-degree sweep, and here I am getting the full view of the prostate. So try this maneuver repeatedly and you will be perfect. It's not that difficult. It is the easiest of all the scanning techniques. Now this is repeating again. Now how do you measure it? On one side of your screen, take the transverse section in full, and then the longitudinal section in full. Okay, now let's measure it. First in longitudinal section, this is the length, then take the width, then depth. And you can see the prostatic volume comes to be approximately 15.6 grams. Normally is up to 40. Now this is an ultrasound of a young 28 years young male, so this is normal for this gentleman. Now I will like to give you a little demonstration post micturition. What happens when you ask the patient to go for micturition and you try to get the prostate. Now the same patient, but post micturition, post void, the urinary bladder has not collapsed post void. Usually it is collapsed. Normally we see. But anyways, in some cases you will see that a small amount of urine will remain in the urinary bladder. Now with this much urinary bladder having a approximate volume of 72 ml, which is slightly more than expected normal. Normal should be less than 50. So there is mild retention because volume is 72 ml and normal should be less than 5. So this is regarding the post-micturition volume of the patient that we were scanning for the evaluation of the prostate. Now in transverse section, what I have noted, with this much of volume of urine, that is up to 70 or 80 or 90 or even 40, it's very easy to evaluate the, or your life becomes easy to evaluate the prostate. It's very easily picked up by the same technique as I showed you. Now this is the transverse section of the this is the urinary bladder in transverse section, and this globular hypophobic area is the prostate. Now I'm going to give a sweep to the probe of about 60 to 90 degree, and then the right and left maneuvering, I can get the prostate easily with no pressure. I don't have to give pressure. I don't have to exert a lot. So if you come across a urinary bladder that is moderately filled, not filled too much, it's easy to pick the prostate and measure it and see that if there are any calcification within it, or if there is any focal lesion or periprostatic, what is the status of the periprostatic fat, etc. So now if this urinary bladder had been, if I had to scan this person with a bladder having a urine volume of 200, 300 or 400, but then you have to, then it is rather difficult because you have to give pressure, a lot of pressure. You have to go up, then you have to go down, and even then you don't get the correct measurement. This is the amount of urine which is more than sufficient for the evaluation of the prostate in any given patient. See, this is the prostate in transverse section, and this is the prostate in longitudinal section. This is the seminal cycle. Thank you very much.
Yeah.
Now this is the suprapubic region. Again, I want to show you what we do for the ultrasound of the prostate. Now place the probe transversely above the suprapubic region, and then angle it towards the patient's legs, or and wherever you get the full dimensions of the uterus, keeping the probe over there, give it a sweep of 90 degrees and you will get the longitudinal section. Here you may have to give a little bit of right and left angling, maneuvering. So let's see it on the ultrasound how I do it. This is now I have placed the probe above the suprapubic region, and one of the benefits of placing the probe transversely at the suprapubic region will be that you will be able to see the seminal vesicle as well. This is the urinary bladder, and this is the seminal vesicle. Now this much of urine is enough. If the urinary bladder is filled more than this, we can get the prostate, but it becomes a bit difficult. With this much of urine, 100 cc, it's okay. It's very easy to get the prostate. Now, placing the probe at the suprapubic region, first of all, you will come across the seminal vesicle, mustache-shaped structure. As you will angle the probe towards the patient's feet, and as you go down here, you will see that you get full of the total. If you go further down, you are going to lose the prostatic tissue. If you are slightly high up, you are again going to lose the prostatic tissue. This is the prostate, and here, this is the area giving you a proper view of the prostate in transverse section. And this central tiny anechoic area is representative of prostatic urethra. Now, keeping the probe in the same position, give it a sweep of 90 degrees. Here it is, and you will be able to see the prostate in longitudinal section. This is the longitudinal section of the prostate, where this is representative of the prostatic urethra. Now, any calculus in this region or focally, it will be easily you will easily see it. Now, angle it right and left so that you can see the proper get the proper image of the parenchyma of the prostatic substance. So this is the prostatic substance that is in front of you. The periprostatic line is intact. Okay, and this is the prostatic urethra. Yeah, this one. This you will get with right and left maneuvering angling of the transducer in transverse section. Again, this is the full transverse view of the prostate with the parenchyma, and this tiny cystic area is suggestive of prostatic urethra. It's not necessary that you will get it in every patient, but go try on, you may get in some. This is the prostatic urethra. So any focal lesion, any calcification it will be depicted easily by this maneuver. So in fact, the point which I wish to enlarge upon is that try to evaluate the prostate with a relatively filled urinary bladder, not overfilled urinary bladder, or collapsed urinary bladder. This much of urine is enough, because the trend is that you ask the patient to drink a lot of water and then you see the prostate. No, it's moderate amount of urine, 100 cc plus minus, is excellent for the custody of the prostate. Thank you very much.